A National Center for Rehabilitation Robotics is the vision of the Physical Medicine and Rehabilitation Department at the University of Michigan. This center would align with our mission of providing state-of-the-art clinical care, education, and research. In the clinical care area, we would create a therapeutic robotics and technology center that would allow us to deliver comprehensive robotic rehabilitation to patients throughout their continuum of care, from acute hospitalization to inpatient rehabilitation to outpatient services. The Therapeutic Robotics and Technology Center will allow us to facilitate optimal recovery and patient outcomes by maximizing the rehabilitation potential of individuals with mobility and upper extremity impairments. We currently have 2 robotic devices and several computer technologies utilized in our department that would be part of this center. Those robotic devices are the ReWalk and the Locomat. The ReWalk is a lower limb-powered exoskeleton that allows individuals with spinal cord injury and other impairments to walk independently. ReWalk users control their walking through subtle trunk motion and changes in the center of gravity. ReWalk has shown many benefits to patients. Some of those include decreased pain and spasticity, improvements in sitting posture and trunk control, and the ability to walk over ground safely for longer distances.
I've been using the Locomat for a few years now with the adult neuro population. Since I've started using the Locomat, it's really been a nice adjunct to my treatment sessions. The patients are now able to aim for goals that we maybe weren't able to aim for previously. We might not have been able to achieve them so efficiently. The patients are so much more encouraged. They come onto the Locomat for that first time and you just see an uplift in their spirits and their morale. It's a wonderful thing. And they are so much more excited to come to therapy. They're more interactive. They're engaged. They're excited to be here. Then when we added the augmented feedback, it's taken that one step further. We are now able to be much more interactive during the treatment sessions. The outcomes are better. I'm able to give the patient better feedback throughout the treatment session. The augmented feedback is also much more fun and engaging for the patient throughout the entire treatment session.
I'm a pediatric physical therapist with the neurorehabilitation program, which means that I primarily see kids with acquired neurological conditions. The Locomat has been a really integral part of my treatment sessions the last few months. I've seen conditions ranging from spinal cord injuries all the way to polyneuropathies from cancer treatment. And I've definitely seen the physical benefits of the Locomat, but more so, I mean, the mental and emotional benefits that these kids get from using this equipment. Their confidence just soars, getting back up on their feet for the first time since their injury. And that confidence, that's carried over onto our overground PT sessions as well as in other therapies. So it's just gone above and beyond my expectations for a treatment modality.
I got the Locomat, yes, I try to do this, yes,
I see the general outpatient population and have had the opportunity to use the Locomat mostly with my patients with a diagnosis of cerebral palsy. I have found the Locomat to be extremely valuable for these patients who are able to work on their gait skills in an upright position and learn strengthening and movement patterns that they've really never been able to experience before. And this has translated so well into their overground ambulation and other transitional skills. So it has been extremely valuable. And I know the patients feel the same way. I am very much looking forward to continuing the use of the Locomat with this population and children with other diagnoses.
Alright, this is Mia using the Locomat. What do you want to tell everybody about the Locomat, Mia? Do you like it?
Yeah.
Yeah, why do you like it? You get to walk? Yeah.
I feel my toes.
You feel your toes. That's awesome.
What do you like about the Locomat?
I like when we walk. And the person, when one person moves, I get that's my animal. That's my
Yeah, tracking down the animals.
Does that make walking a little more fun? Yeah? Does this make you work harder at walking? This machine? Yeah.
And I really like Sarah.
Does Sarah make it fun?
Yeah.
Gabe, can you tell me what you're working on here?
I'm working on winding over to knock a towel down by winding on a scooter.
Okay, let's see it. Tell me a little bit about the Locomat.
Well, it's fun walking because I really get to press down on the and start to walk again.
Yeah. So how do you feel when you're on the Locomat?
Good.
Yeah. And do you think that it's helped you do some walking with your walker?
Yup.
All right. This is Gabriel using his walker.
Hi, my name is Brent Fry, and my daughter Alina uses the Locomat here. And the biggest thing I think I see with her is just the movement of it. Gives her a simulation of what a normal walk would be like if her body would allow her to do it. With cerebral palsy, her brain gives her messages that kind of conflicts with her muscles, but I think that the Locomat, like the greatest thing I see is that it gives her a sense and lets her body know what a functional walk is, and I see better walk out of her after she's done using it, even in the short time that she gets each week. And so we were really excited for the opportunity to get to use it, and we really appreciate donors and people like you who provide stuff like this for children in need, and especially with cerebral palsy or other muscular problems. I think it's great that these services are provided.
Emily has done 2 sessions on the Locomat so far, and she's hoping to do a 3rd one. And it's by far her favorite therapeutic training tool. She's had wonderfully increased gait pattern that she's had. Yes, just a minute. And she's had a wonderful, she's done a wonderful job of increasing her gait pattern. She's carried it over into other realms. She's increased her stamina to the point that she was able to walk in on her first day of 1st grade by herself. And we're definitely looking forward to more therapies and hopefully seeing her get stronger and stronger. What is your favorite thing to do on the Locomat?
Swinging before it starts.
Swinging before it starts. And if you had your choice between coming here or going on the Locomat, what would you pick? The Locomat. Emily likes it so much and she does so well that after Locomat therapy, when you go to pick her up, her legs just automatically start to ambulate.
And I had a broken foot.
She had a broken foot on righty, but hopefully we'll get back on the Locomat soon.
What are your legs doing? Does it feel good?
Can you say thank you? Say goodbye?
Through a strong commitment from our health system and the generosity of our donors, we hope to make this vision a reality.